Hi, it's Jessica DeMassa with WTF Health. I'm here at Bayer G4A's signing day, and we are meeting all of the startups. So joining us right now, I have Maarten. He is the commercial director for CarePay and M-TIBA. And now this is so cool because you guys are disrupting the way that healthcare is being paid for in Kenya. So start out, explain M-TIBA. What is that?
M-TIBA is indeed a mobile-based healthcare platform where people can save and remit for money, but where we also digitize healthcare schemes of the Kenyan government, but also Kenyan private insurance, and since last year also Nigeria, where on the mobile phone people can access their healthcare benefits, and if they go to the clinic, they can pay for that healthcare via the mobile phone.
Okay. This is revolutionary, right? I mean, but tell us in the context of Kenya how very unique this is.
So in Kenya, the mobile revolution started about 20 years ago with the SIM card in its way. And then later on, Kenya is very unique because it introduced mobile money called M-PESA. Mobile money really disrupted the banking, sort of the financial inclusion. So what we are trying to build is an M-PESA for healthcare. It's called M-TIBA, and M-TIBA is mobile and TIBA is treatment. So it's revolutionary because no one has done it before, and it's also a connection, the combination of the healthcare data in one mobile wallet and the financial data. That is what makes us really unique. So if a patient on our platform goes to the clinic, we not only collect medical data, but also financial data of that specific treatment in real time.
And so the claim, like the medical claim that we would know in another, like in the U.S. system, that doesn't even exist anymore. It's automatically paid.
It can be automatically paid, you're right. So it's a digital claim. So the provider also connects to our platform. They log into our portal, or we have integrated with their software if it's a big provider, a high-end provider in Kenya. And then the claim goes either to our claim assessors, where we deal with payments on behalf of the government or, for example, a donor organization, or the claim goes to a private insurer, and then the insurance company can assess the claim and indeed pay. And on average, we pay via the platform within 48 hours. Where I'm from the Netherlands, and even in the Netherlands.
Oh yeah, don't talk to me about America.
I think it's 60 days, 90 days, those kind of things. So it's the cycle which is shortened, but also everything around transparency and accountability. So the doctor doesn't have to worry that is this patient eligible or not. If basically the patient checks in via the mobile phone, via their own short code and their PIN, and then they see if someone is eligible, and then the claim is already sort of semi-approved, but we're working towards full automation.
I mean, I have a health insurance background, and like my heart, you should take my pulse right now. My heart is like beating fast. This is so exciting. Nice. So no, thank you. So tell me, I guess, how many people do you have using M-TIBA at this point?
So currently we have 4.5 million registered users. There are about 50 million Kenyans, so it is a substantial part of the population. And they have been enrolled also through our modules, basically apps, large-scale rollout plans. And they're parts of different programs, as we say. So different payers are already using it. And the largest chunk of those 4.5 million people are people who were enrolled under the Universal Healthcare Program, which was launched by the Kenyan government last year. And M-TIBA, which is the brand name of our platform in Kenya, was used to basically manage that pilot scheme, which is now about 2.5 million people in 3 counties. Okay. Then the other part of the 4.5 million are either saving with their own money for healthcare, or they are part of corporate and private schemes.
Explain the saving with their own private funds, because I thought that was an interesting little piece of this as well.
So we started actually with that wallet. It was just because of this M-PESA, where Kenyans are used to pay everything on their mobile phone. I do it as well. I live in Kenya now for 6 years, and we just pay anything with it. So you don't have a bank account. It's in the telco environment. It's not a bank. So we basically thought, let's try now to move people from paying purely out of pocket once the event has occurred, you have broken your leg, try to move them into saving for healthcare in a locked wallet. So what we've built on top of the M-PESA ecosystem, a locked wallet for healthcare, which you can only spend in the clinics we connect to, or you can remit money up country to your family, and then you are assured that that money is spent on healthcare. And that alone basically attracted 1.23 million people in a year's time, and that opened up to the company where we are today. And this was 3 years ago.
So I know you explained a huge chunk of the people who are using the platform are using because of the government scheme. So what are your plans for scaling? Is that scheme, you guys were piloting it, is that going to be expanding? How are you guys going to grow?
It's a bit too early to say that we will be the partner of choice for that, but the government is currently looking at its options. But we are very confident that we will play a role in the nationwide scale out, but there is a lot still outside our control. But by doing that massive enrollment, we enrolled 2.5 million people in less than 4 months. Some days we had 100,000 new enrollees per day. We are confident that we can use this platform to scale, and that's why we also went to Nigeria. Yeah. And you've heard from some other speakers today that Nigeria is, of course, the market to tackle. If you can do it there, you can do it anywhere, they say. So we started in Lagos, where we have now a full contract with the Lagos State Health Agency, and they're going to roll out a compulsory scheme as well. Okay.
So what are you doing here at Bayer?
That's a good question, actually. I personally wasn't aware that we admitted our proposal a few months ago.
Oh, so it was a surprise. What a pleasant surprise. A gigantic life sciences company wants you to come. So what are you here for?
So we have engaged with Bayer in East Africa, and what we like to do with the commercial partners such as Bayer, who are a very important stakeholder in this healthcare supply chain and the healthcare delivery and affordability, we like to see if we can, via this digital platform, create market access programs and then look at certain price point levels so that the affordability becomes bigger, and that out of this 4.5 million people, which are growing every day, that more people have access to quality drugs and healthcare.
Oh my God, I have chills. I'm so excited about this. Price transparency, mobile payment, disintermediate. I love it. Thank you so much for stopping by. The company is called CarePay. It's M-TIBA that they are launching. Thank you so much. I'm Jessica DeMassa with WTF Health. Thanks so much for joining us.